Hello, Uta here with the beautiful salvia. I don't know if the hummingbird has already left. And there's the great big foliage plant. The name is escaping me at the moment. Coleus. And we've got the blooming sedum. That's some roses and this sculpture of mine. And I'm just working my way back to my bench so I can give you recent data and debunking of data from 2011. And I also wanted to give a shout out to a new detransitioner YouTube channel called Sarah Rachel, and that's Sarah with an H, Sarah, Rachel. And you can find it by Sarah Rachel Detransitioner in the YouTube search line. This is a classic case of regret and a classic case of the phases of detransition. And I really want to recommend to all the detransitioners that they start doing like I'm doing with collecting data on on trans widows, women who left suddenly cross-dressing men, because I think it would really help them to understand that there are stages. And a lot of times the first stage involves this really strong regret and realization that you cannot escape from your biological sex. You were born either male or female, and that you have been lied to when you were told that you could change your sex. And there's often, they often express that they do support true transsexuals, but now they realize they aren't. And I think what proves that there really is no true trans is that you can't predict who is going to regret this 5 to 7 to 10 years later, even up to 30 years later, as Dr. Stephen B. Levine has testified. Now, so that's the Sarah Rachel Detransitioner YouTube channel. And I really do recommend at least giving a like, even if you feel like you are not able to subscribe, and write some positive comment, because it's a small channel. These channels need to grow. And I just so appreciate all of my old stalwarts and all of you. Please hit the like and hit the subscribe here, and write some kind of appreciative comment. It's not that I'm just seeking praise, but something about how it's so important for the truth to come out, and mainstream media is not telling us the truth. It's just so important for this channel and others about this issue to kind of come up on the feeds, and all of the comments and the words help the algorithm. A lot of us are shadow banned. I believe that I might be somewhat shadow banned. I think that it's easy for them in the tech world to have keywords that they then kind of make it harder to find the information that we're giving. So here we are with some new research from Susan McPherson, a professor of psychology and sociology at the University of Essex. This is over in the UK. And David Freedman, retired social scientist. They found that the majority of children put on puberty blockers and hormone drugs experienced erratic and fluctuating mental health, including over 1/3 whose mental health reliably deteriorated. So that's quite a lot. Now, there were 44 in this. Here it is. The original study, conducted on 44 children between the ages of 12 and 15, was reportedly based on group averages, while the new analysis relied on individual results, which McPherson and Freedman explained allows us to look at how a treatment is performing in terms of the percentage of patients improving, deteriorating, and showing clinically significant change. It is possible using this approach to look at patterns, such as who is benefiting and who is not. And this fits into my statement that if you said to a child or an adult that gender dysphoria is a very difficult and real psychiatric illness and you can work on it, we suggest that you will slowly get better in 5 years. And you know what? People who have other mental health illnesses, mental health issues, it will often take 5 years to figure out what works for you to get yourself better with mind-body movement, with meditation, with prayer if you have faith, all of those methods towards wellness. So this continues. Last year, Britain's National Health Service opted to close down the Tavistock Gender Identity Development Clinic after a government report found that the staff rushed and even pressured minors into taking puberty blockers and hormone drugs with almost no psychological or medical oversight. And this has to do with the false narrative of the suicide, manipulation, which we know is happening on Reddit and Tumblr and all these social media things. The kids are basically given a script, they're warned. Those who haven't expressed suicidal ideation are told they might get suicidal if they don't go down this path, when actually the opposite is true. It appears that when you are taking wrong sex hormones, the suicidal ideation and actual even completed suicides, etc., goes up. We know that from the Swedish study. You can find my commentary on all the articles presenting the valid studies and critiquing the badly done studies, the low quality studies, at Uta Hagen, Grass Widow, all one word, .wordpress.com. That's always in the notes. And by the way, we do have in the works, it looks like Trans Widow number 54 has requested my survey. And so, now we're going to have data on 54. Okay. Reported 96% of child patients were placed on puberty blockers by Tavistock staffers, and concerns were raised over a tendentious focus on gender dysphoria instead of considering other psychological factors in recommending drugs or surgeries for minors, which were summarily dismissed. And this is the conflict of interest from all the pressure from groups like Stonewall and the whole alphabet community putting pressure on the clinicians, it really threatening, harassing, and defaming people who are saying, wait a minute. And I just know, based on the defamation that my ex-husband Nettie engaged in court documents of me, blaming me on his decision to go cut off his private body parts at the Stanford University Medical Center in 1996 after the one appointment diagnosis, July 20th, 1993. In fact, the situation was so concerning that Dr. Hilary Cass, the pediatrician tasked by the government with investigating the claims against Tavistock, offered her recommendation to shut down the clinic several months early, saying she had enough information already to justify closing it. Cass particularly stressed concerns she had over the use of puberty blockers and other hormone drugs which the Tavistock Clinic had been prescribing to children as young as 10 years old, many of whom were already on the autism spectrum or suffering various mental health issues like depression or eating disorders. In her interim report to the NHS, the National Health Service, Cass said, "There is a lack of consensus and open discussion about the nature of gender dysphoria and therefore about the appropriate clinical response." She added, "There has not been routine and consistent data collection, which means it is not possible to accurately track the outcomes and pathways that children and young people take through the service." Over the years, numerous whistleblowers, former staff Governor David Bell, Marcus and Sue Evans, Child Safeguarding Officer Sonia Appleby, and countless former patients who now, as adults, regret being put on puberty blockers and hormone drugs, have sounded the alarm over the Tavistock Clinic's practices. Most have pointed out that children and their parents were often denied informed consent of the risks, as staffers rush children onto puberty blockers after only 3 or 4 meetings. And here is where De Vries and Martinius and Steensma, the Dutch researchers, in all of their follow-ups, they make excuses, they shrug their shoulders, and claim that, well, we know that they had gender incongruence, and so this is going to continue all through their life, when they promised those kids that we were going to solve this problem. Some whistleblowers even explained that topics like sexual orientation were effectively off limits, and that a transgender identity and a battery of hormone drugs were the only options explored by clinicians. Others pointed out that the drastic rise in children going through that clinic from 250 in 2011 to over 5,000 in 2021, and it has been linked to the growing puberty blocker and hormone drug industry, in other words, advertising. The findings of the new analysis of the Tavistock study are in line with research conducted and published by Family Research Council. Jennifer Bowens, B-A-U-W-E-N-S, Director of Family Research Council, Center for Family Studies, explained earlier this year, at one time, gender dysphoria was considered a mental disorder, but now, due to the increasing prevalence of a worldview shaped by gender identity ideology, it has morphed into a human rights issue. The ideology borrows from the mental health aspects of gender dysphoria in order to justify medical intervention. She continued, advocates of gender-affirming care insist it is both life-saving and evidence-based health care for those who identify as transgender. But the research used to make such a claim is full of methodological errors and can be easily disputed as a research body that is incomplete. The research is all low quality with incorrect conclusions of studies. Even the Swedish study, which was studying the death records of and had matched, age matched, and income matched records of deceased people in Sweden. The group studied was those who had had these surgeries from 1973 to 2003. And I'm trying to remember, now I'm not remembering whether that was that was also, I think, in 2011. Yeah, the Dutch study was 2014. So the researchers hid that the suicide rate of those who had had those surgeries and medicalizations for their cross-sex ideation, the women were 40 times higher to have ended their life at their own hands, and the men were 19 times higher to have ended their own life than the control group of also, unfortunately, deceased Swedes who were matched by age. And this was like hundreds. It was a good quality study, and the researchers decided they had to hide that female statistic of 40 times higher, because it just didn't look so good and they were going to get a lot of flack. And so they combined the males and the females so that it was closer to 19 times higher. So, and this is not 19% higher. This is 19 times higher. That means for every one Swede who was not, transgender, if you want to call that, for every one Swede who was just your normal, typical person who had ended their life by their own hands, there were 40 of those who identified as the opposite sex who did that among women. Okay, now, Bowens continues. Not only are the currently published studies problematic, but there is a lack of ongoing and long-term follow-up reports that address the impact of cross-sex hormones and surgeries. Now, this, I think, all has to do with the fact that they have not even done a behavioral analysis of the dopamine hits that you get from cross-dressing and from having power over everyone around you, strangers, family, friends. You have power over everyone around you to compel their speech. And so that gives you a lot of power. That is ritual manipulation and control. In June, the NHS banned the use of puberty blockers and hormones on minors, following a growing swath of European medical experts who have backed off of the gender transition procedures for children. And I say to the Dutch, when are you going to join your fellow Europeans in admitting that your studies with end results from only 33 subjects and stuff are any indication that this is successful? France, Sweden, Finland, and Norway have also put restrictions on the use of puberty blockers and hormone drugs in children. The U.S. still hasn't. So, all up and down, we've got really kind of abusive, there's the hummingbird. Wow. So the hummingbird is still here. I can't get it. It'll fly away. But, just have that picture in your mind. Okay. So keeping in mind that, in my data, with over 50 trans widows, 19 of us had been sexually assaulted by cross-dressing husband. The hummingbird is still there. And let's see, of 53 of us, 15 of us were physically assaulted by husband. Now that doesn't indicate real happiness at all. That doesn't indicate real happiness at all. I've been called all kind of things. And I just say that just washes off me like a duck. And I'm even talking about not the trolls who come on here and try to say stuff. I am meaning there were parents who were a little off, who were defensive, who accused me of discriminating against their child or something like that. And I just said to myself, well, by the end of the year, they'll see what a good teacher I am. I'll make sure the kid takes home a beautiful painting or something, And so why is it that the netties of the world, like my ex-husband, can be controlling all of the people around them? This is immensely disturbed, hard work that I think what happens with the detransition process is the exhaustion of doing this sets in. And really, the rate of regret looks like around at least a third, and who knows what it is, 10 more years later, like 20 years later. Renee Richards, one of the early surgical mutilation transitioners, who was famous for suing the tennis organization to play as a woman, and did some kind of doubles thing as a woman, he regrets it. He told my friend, who was his eye care patient a few years ago, that he regrets it. So, I think it's too bad that he doesn't come out public, but I'm doing it for you, Dr. Richards. All right, this is long enough. The hummingbird is gone, but I'm going to try to catch it again sometime for you. Now, you be well always. Be sure to notice the flowers and the bees and the butterflies.